Hello guys, welcome to Fast Coder 21 YouTube channel. The purpose of the channel is to share knowledge and gain knowledge. So if you share the knowledge only, you will gain the more knowledge. This channel is created for the people who are currently working as a medical coders, like experienced people. If you are entering into the medical coding field, you can visit this channel. And if you are going to write CPC exam or CCC exam, you can visit our channel. So if you have any topics in your mind that we will discuss and create a session for the topic. If you don't want to miss future sessions, please subscribe to our channel if you are visiting first time. And also help your friends to subscribe to our channel get get notification. As we are providing this coding information from the reliable resources, please watch until the end to gain more knowledge, as these are helpful for entry level coders, experienced coders, as well as the people who are going to write CPC or CCS exams. Today our topic is ICD-10 CM interview questions part 1. First question, if you go any interview, they will ask you first tell me about yourself. Here we need to tell the interviewer about our past, present and future. So we need to be genuine to answer this question. So second question, mostly they will ask, why do you want to join in our company? So tell the reason which is more impressive based on your situation, and if you have any reference, you can tell them that I have a reference. And if you have any positive feelings about that company, you can tell them that I have this information about this company, so I would like to join. Question 3. What are the organizations are involved in makeup of ICD-10 CM? So basically these are basics, but these are very important in interview process. Uh, if you are writing any certification exams also. Answer, American Hospital Association, usually we will call it as AHA. The American Health Information Management Association, we will call it as AHIMA, CMS and NCHS. These are the organizations who will make ICD-10 CM. Question 4. Among the instructions, conventions of the classification and guidelines, which is having top priority? Means if you have conflicts among instructions and conventions versus guidelines, which one you code first or which one you follow first? So usually instructions and conventions are precedence over guidelines. Question 5. What is the full form of HIPAA? Answer, Health Insurance Probability, Portability and Accountability Act. As you know, medical coding profession is working under HIPAA compliance. So we need to know the full form of this HIPAA. Question 6. How many sections are there in ICD-10 CM? We have 4 sections in ICD-10 CM. Question 7. What is section 4 in ICD-10 CM? Section 4 is outpatient coding and reporting. So what are the minimum characters in ICD-10 CM? Answer is 3 characters. Using 3 characters also, we can make a code. Question 9. What are the maximum characters in ICD-10 CM? As all of us know, we have 7 characters to make a complete code. So basically, with 3 characters also we can make a code, and with 7 characters also we can make a code, whether either 3 or 7. Question 10. What is the placeholder characters? Your answer, X. For example, if you are using injury and poisoning codes, you need to use X characters for future expansions. Question number 11. What is NEC index? Answer. Not elsewhere classifiable or not elsewhere classified indicates that the physician provided additional details of a condition, but that the ICD-10 CM book did not include those extra details in any of the other codes in the book. So physician will provide the more information, but we don't have a code in ICD-10 CM2 code. Question number 12. What is NOS? Answer. Not otherwise specified means that the physician did not document any additional details that are identified in any of the other available code descriptions. So physician will not mention clearly about these codes. NOS means unspecified. Question number 13. Can you tell me one example for excludes 1? Answer. If we code G43.0 migraine without aura, we have exclude one convention under G43.0, which is chronic migraine without aura G43.7. Here we can't code chronic migraine with unspecified migraine. So example 2 is we can't code congenital conditions with acquired conditions. Question 14. What is excludes 2? Answer. The excludes 2 note also means that the condition excluded is not included in the condition represented, yet the patient may have both conditions. If documentation supports both conditions, then both codes can be assigned. So when we find any code with excludes 2 under it, we can code both conditions if patient has. Question 15. What is etiology and manifestation? Answer. Etiology means underlying cause. Manifestation means the condition which is resulted because of etiology. Question number 16. What would you do with code also convention? Answer. A code also note instruct that two codes may be required to fully describe a condition, but this note does not provide sequencing direction. The sequencing depends on the circumstance of the encounter. So whenever we have this convention code also, we need to code additional code based on the code also description. Question number 17. What is meant by other specified guideline? Answer. Other specified means the same thing as NEC. Here the physician specified additional information that the ICD-10 CM book does not have any of the other codes in the category. Question number 18. Can you tell me one example for conditions that are not an integral part of a disease process guideline? Answer. For example, a patient may have cirrhosis of the liver and the symptom of ascites. Because ascites is not routinely associated with cirrhosis, it would be reported in addition to the code for the cirrhosis. So basically, there are more reasons for to get ascites. So we need to code ascites based on the documentation. We need to check the what are the reason for ascites in the documentation. So we can code if ascites is not related to cirrhosis, we can code both cirrhosis and ascites. Question number 19. When do you code multiple codes for a single condition? Answer. In some instances, two codes are required to fully classify a medical condition and an associated manifestation or underlying cause of disease. For example, if you take urinary tract infection, site not specified, we have a use additional code guideline. For example, patient has urinary tract infection due to H. pylori. So we need to code B series code to identify the infectious agent. Here condition is one, but we are coding two codes. Question 20. If the patient has the same condition with both acute and chronic severity, which one you code first? Answer. Based on ICD-10 CM guidelines, we need to code acute condition first, then chronic condition. Question number 21. Can you tell me one example for a combination code? Answer. For example, if a patient has the diagnosis of diverticulosis with bleeding, code 57.91 classifies both conditions using one code. So here key 57.91 is diverticulosis with bleeding, as these are two conditions, but we are using single combination code. Question number 22. What is sequelae? Answer. Other name for sequelae is late effects, which means the residual effect condition produced after the acute phase of an illness or injury has terminated. Example, burn scar. Question 23. How do you code sequelae? Answer. Coding of a sequelae generally requires two codes. With the code for the condition or nature of the sequelae, code the condition residual listed first, followed by the code for the sequelae. Code using the main term sequelae. First, we will code the residual condition which is developed due to the underlying condition. Then we will code the condition which is responsible for the sequelae. Using the, we need to use sequelae in the alphabetic index to check the condition. Question 24. How do you code a ureteral calculus on the left and right ureter? Answer. We need to code N20.1 only single time. Question number 25. How do you code bilateral breast cancer? Answer. We need to code C5911 and C5912. So if we have bilateral code, we need to code that one. If we don't have bilateral code, we need to code individual codes. Question number 26. How do you code if there is no laterality in the document? Answer. Based on ICD-10 CM guidelines, if the laterality is not documented by the patient provider, code assignment is for the affected side may be coded based on the medical record documentation from other clinicians. Question number 27. What are the conditions you can code other clinicians other than patient's provider? Answer. BMI, depth of non-pressure chronic ulcers, pressure ulcer stage, coma scale, NIH stroke scale, social determinants of health, laterality, blood alcohol level, which means here the provider must and should document the condition. For example, if you take body mass index from the other clinician document, obesity or morbid obesity must and should documented by the provider itself. So basically, if the other clinician documents obesity or morbid obesity, we can't code, but provider documents, we can code body mass index from the other clinician's notes. So provider must and should mention the documentation. Question number 28. What can you do if there is no syndrome listed in the alphabetic index for any condition? Answer. Based on ICD-10 CM guidelines, we need to assign codes for the documented manifestations of the syndrome. So for example, if you have a condition, you will check syndrome, but you don't find that condition with syndrome in alphabetic index. So we need to code manifestations of the syndrome. Question number 29. How do you code borderline diagnosis? Answer. The provider documents a borderline diagnosis at the time of discharge. The diagnosis is coded as confirmed unless the classification provides a specific entry. Example, borderline diabetes. So we need to check the key term borderline. So we have any condition, we need to code that condition. Otherwise we need to code the condition itself if you don't have borderline in the alphabetic index. Question number 30. When do you code symptom as the final diagnosis? Answer. If a definitive diagnosis has not been established by the end of the encounter, it is appropriate to report codes for sign and or symptoms in lieu of the definitive diagnosis. In lieu means instead of definitive diagnosis, we can code signs and symptoms. So guys, part 1 of ICD-10 CM guidelines ends here only. We will make one more session for remaining guidelines with examples. Please help your friends to subscribe to our channel. If you are visiting first time, please remember to subscribe to our channel. Thanks for watching. Happy coding guys. If you have any comments, please mention in the comment section.